Hello everybody. Today back again with another topic. I think it is a bit of the topic before below 3 months of age. We are doing that now. So basically, we'll be discussing today about tongue tie. It is a condition present at birth and restricts the movement of baby's tongue. Um, is that underlying underside of the tongue is connected in the floor of the mouth by a piece of tissue called lingual frenulum. In babies with tongue tie, that frenulum is thicker and tighter than usual, and that restrict the movement of the tongue and cause the problem of feeding. A tongue tie can involve the entire underside of the tongue or just part of it. Tongue tie is thought to affect approximately 10% of the babies and more common in boys than girls. And half of the babies have, tongue tie someone else in the family. So that is common that, families runs in the families. Now, what are the symptoms? You can see the tongue tie. Baby, when the newborn physical examination, not always easy to spot until, then when there is some problem in the feeding is there, breast or bottle feeding. Some of the babies' effect is very mild, and others it can cause very, very difficulties. So now in the breastfed babies, baby syndrome may have difficulty in attaching to the bed or staying attached, feed for longer time and have a short break, then feed again, be settled and appears to be hungry most of the time, not gaining weight as quickly as they should, be very windy with excessive hiccup and flatulence, have difficulty in controlling milk flow, coughing and choking, and make clicking noise when feeding. And mothers also sore, damaged nipple, not producing enough milk, get mastitis, means inflammation of the breast, and get exhausted from frequent feeding and having unsettled baby. And baby in the bottle fed babies take long time to feed, can take small amount of milk at each time of feeding, dribbles a lot during feeding, and be windy, not gain weight as quickly as they should. And mom will regularly spend long time to feeding the baby. Find that changing the bottle teat does not help. So maybe that your baby experience some of the symptoms. So it may be they may have tongue tie. So you have to, thinking that there is some difficulties they're experiencing. So now severity of this, severity can vary. I already mentioned about this. So basically, you can see that baby is finding unable to open the mouth, and also her tongue unable to cover the lower gum. Movement of the tongue during sucking differ from usual rhythmical pattern, and it is during the breastfeeding and bottle feeding difficult to create a seal around the teeth, and they may cause their suck to be inefficient and feeding take longer time. So actually, if there is you are concerned that is some tongue ties is there, so you please talk with health visitor or midwife, and there will be some feeding assessment that time. Now this support system is there if you have this suspect that there is some feeding problem, and tongue tie specialist are there, and the baby will be referred to that. So the tongue tie specialist will look at then the tongue tie of your baby. Now, if they think that there is a need of, tongue tie release, which is called frenulectomy, it's a very simple procedure, and it is usually done before 6 months of age. Only takes a few seconds and does not require any anesthetics medication. Babies little bit cry, and after the procedure, although majority of the baby cry less than 1 minute, and the use of tongue tie release to improve feeding support, supported by NICE guideline. It is a safe, simple procedure and significantly improve the feeding, particularly breastfeeding, reduce the nipple pain and improve ability to latch. And before the procedure, it will be discussed and ask for your consent. And vitamin K injection or the oral drop should be given more than 24 before the procedure. Baby should be fit, not having any medical condition. Any blood clotting disorder should not be there. So it all should be checked before the procedure. And during the procedure, wrap the baby in a blanket, hold them gently to hold the body head still. Release the tongue tie using a sterile round-ended scissors, and apply some pressure under the tongue to stop the bleeding with a piece of sterile gauze. Usually it's only few drops of blood. Once it is done, unwrapping of dyeing for the baby, encourage them to fit straight away. Help the baby's tongue to move and prevent the tongue tie from refusing. So these are the usually steps. You may remain with this, and if you prefer, then your midwife can take your baby in a separate room. So basically, after the procedure, small blister may develop in the tongue first couple of days. This is painless and does not interfere with your baby's feeding. Can be sometimes a bit unsettled, fussy for a few days. It may take few weeks before baby is fully comfortable to feed. And possible risk is that, of course, there is some but little risk, but there is maybe a bit excessive bleeding, infection, ulcer, pain. Sometimes it can again tongue tie reoccur because frenulum refuse. So because these are the things. So all will be discussed with you before that this is done. Sometimes tongue tie can persist. Majority of the child has no difficulties with the speech. The presence of tongue tie has been shown to influence the ability to pronounce certain sound. However, it is impossible to predict which child will be affected or to determine whether treatment as a baby will prevent this. Speech difficulties are usually noticeable by the time a child reaches the 3 years of age. But if you think it's speech affected, causing problem, then you can contact GP and for visitor, and then they will be referred to the speech and language therapies for the assessment. So I think it is the nutshell about tongue tie, and it increases your awareness about this condition and you know how to deal with it a bit. We'll come back to you again with another topic. Bye for today.